My name is Angela Pound. I'm the STEM counselor here at Mission. And today what we're going to be talking about is really pathways into nursing. It's going to be really brief. And then we have our current nursing student who's going to be talking to us about her experience going into an entry-level master's in nursing program. So here's what we're going to go over very quickly in the next 30 minutes about nursing. And so we know that you're all nursing, pre-nursing, right? I don't think I've met you.
No.
No? I'm Angela.
Edwin.
Nice to meet you. And so have you decided that nursing is for you, or are you thinking maybe?
Yes. Right now I'm a medical assistant, and so far I love being in the medical field.
Okay.
And I want to advance to registered nursing.
Cool. Very cool. So we all know why we're here. It is one of the fastest growing occupations. It has been for a very long time. And so there are a lot of jobs in the profession. In the next couple of years, this is an older survey, but there's always this expectation that there's going to be more and more growth as we have a larger aging population and we have a growing population in general. We know that there's going to be a lot more jobs for nursing. There are different places where nurses work. So a lot of times we think about nursing at the hospital, but they're actually in different places. So there are general and surgical hospitals. Those are the ones we know. If you work in a doctor's office or a clinic, there are nurses there of different levels too. There are nursing care facilities, just like Maclay right behind us, Care Center. And then there's outpatient facilities, and then home health services, where some of our nurses travel to homes, making sure that their patients are okay at home. Or sometimes they're there for full 12 hours, and then they trade shifts for in-home care. And then there's also there's nurses at schools, right? There's always a school nurse. Did you know Disneyland hires BSN holders, nurses? Because they have nurses on staff, just in case there are emergencies. So in my family, we have a lot of nurses. We have my sister, she works as a nurse for County Hospital at USC. And then my brother, he's an LVN for the LA County jails, so the men's jails out in downtown. He works up there, and then his wife, my sister-in-law, works at Cedars-Sinai Hospital. So those are very different places, whereas county, you can kind of get like everyone, whether or not you have insurance. Cedars-Sinai is more of, in the wealthier areas. She actually works on the floor where all the celebrities are. So it's like completely different than what her husband does at the jails, right? But then sometimes my brother and my sister share patients, because the patients at the jails, if there's an emergency, they get rushed to county. So it's kind of cool how that works out. But there's lots of opportunities in nursing. So there's also different specialties in nursing. And so when we hear about from our nursing student later on, we can ask her about or she might talk about what her specialty is, or where she thinks she might be doing. And it's okay, in nursing school, it's okay that you don't know what your specialty might be, or what area or what population you want to work with. In clinicals, they really test you. They put you in places where you wouldn't even want to, but it's good, because then that makes you a better nurse. But there's different areas, from an associate's degree to a doctorate degree. There are different specialty areas, including advanced practice, emergency, psychological, clinical, family, surgical, community management, and women's health. So those are only some of the areas, but there's definitely a lot more. So here we have an image of our degrees in nursing. So for our degrees in nursing, so these are the different types of degrees that we have in nursing. We'll start from the bottom, which is our CNA, which we do have a program here for CNA through the Allied Health Office. You can get it as little as summer session. If you do the full-time summer session, You can get it by the end of like 8 weeks. And then after that, you take the state exam, and then you can already start working. If you want to get the certificate from us, there's additional courses that you would have to take, which are the health occupations courses. And so with that, you can already start working. We have facilities that are looking to hire students. McClay just called us, and then another facility, and they're looking to hire like 20 people. So they're in demand, and it's a good way for you to get your feet wet if you don't work in the area. A step above that would be the LVNs, which are licensed vocational nurses. They're training. LVNs are usually at some community college programs have it, and then there are also the private colleges that offer the LVN programs, and it's about a year of a program, and you can start working right away. What we do work towards also, if you are a pre-nursing student, if you want to become an RN, we would look at the second level. So as a registered nurse, you can start working with an associate's degree, with a bachelor's degree, with a master's degree. And so the ADN is what you would take the prereqs here for, and then you go into that at the community colleges. So pretty much every community college for us, we have COC, LABC, Pierce, Glendale, and PCC, just to name a few in the area. So with that, you graduate after 2 years, you go to their program, 2 years, and then you can already become an RN as soon as you pass the NCLEX. For the BSN, same thing, you can take the prerequisites here, go to a BSN program like Mount St. Mary's or Cal State LA, and then you're already an RN as long as you pass your NCLEX. And so, so the main difference between those two is the degree. With the bachelor's, a lot of the bigger hospitals are looking for BSN holders eventually, or sometimes your employer, you might start working with an ADN and your employer expects you to get your BSN later down the road. And that is possible too, and I'll show you in a second. And then we have the MSN programs, which are, it's a graduate degree program, and then a DNP and a PhD. And that's kind of like the higher level, especially if you're looking to teach or do research in the field of nursing, not be like a floor nurse. So this is what I was talking about, the CNA, Certified Nursing Assistant. It is providing hands-on healthcare to patients in medical settings, training opportunities offered in vocational technical schools, like I said. You do have to take the test, and then within 2 years of completion of the program. And that program is provided here at Mission College. The LVN I talked about we'll talk about really briefly because I want to get to the RN stuff. The LPN is just another word for LVN. In other states, they call it LPN. So if you're looking at programs in other states, let's say you're moving, you'll hear about the LPN. But here in California, they're called LVNs. And so these are usually part of a team of health professionals providing care in a variety of settings. They typically monitor patients' vital statistics, administer basic care, report concerns to the RNs. So they'll do the cleaning, they'll do making sure they're being fed, and their needs are met while they're staying with them. And here's the associate degree in nursing. So you can work in different areas of the hospital and healthcare facilities with an ADN. There are different specializations, but some of the main duties that they have is monitoring patients, updating charts, performing tests, analyzing the results, teaching patients how to manage their illness or injuries at home, and operating medical equipment. Now for the bachelor's degree, it's a little bit different. It does take more schooling, and you can do, if you already have an ADN, you can go into an RN to BSN program. Like I said, some employers are okay with hiring you with ADN, but eventually they'll want the BSN. So you jump into an RN to BSN programs. So schools like Northridge, for example, they don't have one where you can transfer from Mission to Northridge, but they have a program where if you're already an RN, then you could do it. And sometimes it's a bridge program with another community college, and then you can join them and get your BSN from Northridge. So the BSN, the main difference that I've seen from the ADN and the BSN holders are put into a position if you want to be more in a leadership type of position. So if you compare the curriculum, you're learning the exact same hands-on skills. The only thing you're missing are health promotion, case management, that kind of thing. So if you're looking to do more than just be on the floor, you want to be take on a leadership role at your workplace, then the BSN would be good. For this, some things that they do is to develop nursing care treatment plans, educating patients and providing support to them and their families, assisting doctors, administering medication and injections, and supervising other nurses. So if that's something that you want to do, take it a step further. Most people are good with the ADN and they're fine doing that, but other people want that supervisory role and move up in their career. Magnet hospitals, they're hospitals that have been recognized for the highest quality healthcare and nursing, and they do prefer to hire nurses with a BSN. There's always there's like new grad programs also at the hospitals that are looking for BSNs. So without that, you wouldn't necessarily be able to apply to those types of programs. So something to keep in mind. Every nurse that I've talked to, go for the BSN. So this is a MSN, Master of Science in Nursing. You'll include specialty courses to help you in your chosen area of nursing, as well as classes in healthcare, policy, ethics, management, advanced practice nursing, advanced biochemistry, pharmacology, and then wrap up with practicum, so more hands-on. You'll earn your degree at a university. Most MSN programs are competitive, requiring you to juggle many responsibilities. So in the case of the nursing student that we're going to meet soon, she is learning everything side by side. So she's taking BSN courses and her MSN courses at the same time. And so it's kind of nice. When I talked to her, she said it was kind of nice because you see things in a different perspective. And when she's doing clinicals with just BSN students, it's a little bit different with the way that they think about it. Mm-hmm. So that's kind of cool. Maybe we can ask her about that experience too. And then we have the DNP or the PhDs, more into executive leadership roles at the hospital. So at this point, you're probably no longer on the floor. You're just making decisions for the facility or the hospital. Or maybe you're doing research at the institution. And then a lot of times you'll also, if you want to teach future nurses, this is the route to go. So all programs include research, statistics, and data analysis, history and philosophy of nursing. And since the DNP is preferred for nursing executives, you'll also focus on clinical practice-oriented leadership. So a lot of leadership, but that might not come until later on, until you're a full experienced nurse, but know that this degree is available for you. So we'll take a look at the RN programs because that's what most of you are working towards right now. So here at Mission, you'll start out as a health science major. Because we don't have a nursing program, yes, you're nursing, pre-nursing, but here at Mission, you're doing the AS in health science. Because with this, you're going to be ready to apply to both the ADN programs and both the AID and the BSN programs as well. And so once you complete that with your CSUGE, you notice you have two routes. The AS in nursing at the community college or the BSN at the CSUs or private schools. And then same thing, like I said, after your associate degree or BSN, you can take the NCLEX and you can become an RN. The difference is the pay and the responsibilities that you have at work. And then once you do have the ADN, you can jump into the RN to BSN, which is, in my opinion, a little bit less competitive. Some of them do want you to have some experience, or maybe you work and go to school at the same time, which is not a bad deal if you can manage your time effectively. Some hospitals will pay for you, or some facilities will help pay for school. So look out for those opportunities too. But typically, because there's not a lot of people applying to the RN to BSN programs all at once, it might be a little bit easier for you to get it that way. So, and there's just different strategies for all of you to get into nursing. If nursing is a route for you, there is a way for you to get there. Sometimes it takes longer than other people, and but that's okay as long as you get to your goal, right? and then you become an RN. So the preparation, this is kind of what it looks like as an AS in health science major. And so students interested in becoming an RN will get the AS in health science. And so the requirements for you is English 101, math 2 to 7 statistics. So you would work your way up to those math and English levels. I would highly recommend biology 5. How many of you took bio 5? You took 3?
Yes.
Did you take 5?
Yes.
How?
Honestly, if you guys are taking anatomy, like I took bio 5 and I'm taking anatomy right now, it's literally review. It helps you so much. The teacher that teaches bio 5, she's amazing. She can help you with anything. She'll also go over it with you, and usually you'll notice like most of the activities and the labs that you've done, you know everything before, so you're kind of ahead as far as and that class also prepares you for physiology.
Wow.
So
It's a newer class for us, so if you took bio 3, you'll still be prepared. But the bio 5, it's human biology, so it's the stuff that you really have to know. So if you haven't taken it yet, consider taking that class. I know it's difficult because sometimes there's only 1 or 2 sections of that, and it might not fit your schedule. But if you can take it, I would suggest taking it. And so other requirements include chemistry 51, anatomy 1, physiology 1, microbiology 20. And then other classes are like Psych 1, Psychology 1, Intro to Sociology, Sociology 1. Psych 41 is developmental psychology, also a requirement for most nursing programs. Other nursing programs may require you to take nutrition, for example, and then speech 101 or comm 101. That it has to be 101. It's not 151, not 121. It has to be 101 for all nursing programs. It's one of the things that they're really strict about. So all of these courses here you should take. I included some of the GE requirements also because if you are applying to the BSN program, they'll want you to be CSU certified. That means having all of your general education done so you can focus on your nursing program when you get there. So that's that. A little bit about the TEAS test. I'm going to have her speak about it a little bit, but this is basically the test that you take before or during the application process. So some schools want it before. Some schools will invite you to take it at their school. It just really depends, but it's about $50 to $80. It's heavily in reading, math, and the sciences, including anatomy and physiology, English, and there is a book that you can study from. But if you're taking anatomy, physio, microbiology, please save your notes from. Maybe buy the book and save the book so that you don't sell it, so that you can refer back to it when you're studying for the TEAS test. And it is a requirement for them. Most schools cutoff is like 62%, so it's not terrible. But the higher score you get, the higher points you have in certain programs. So with nursing programs, this is a different workshop, but we have the application workshop usually around winter. So for students who are looking to apply, it just sets them up for that. But usually we would go over that and the application process, including the TEAS test. So in addition to the increased demand for RNs in general, many employers have indicated a desire for more highly educated workforce. That means more BSN holders. So I think they did, years back, they did a study on mortality rates at the hospitals. Hospitals with more BSN holders have a lower mortality rate than hospitals with less. So that's what drives the hospitals to hire more BSN holders. So you'll still find a job as with the associate degree, but the end goal is the BSN at the very least. Okay. And so there is a salary comparison that we will email you. This is terrible. But it's pretty competitive once you get to the BSN programs. At the CNA, it's about 25,000 a year. With the LVN, it can start at 45,000. And then the associate degree or BSN starts at like 50, 60. Of course, in California, it's always more because it costs more to live here. But it does go up into 98 and above once you have a higher degree too. So things to look into, right? Money's important, but that's something to consider. Can you live off of a CNA salary for now until you work towards that? And so these are some of the other programs that we have at Mission, especially for those students. This is probably not you, but students who are not sure. Nursing is very, very challenging. It's very rewarding, and salary-wise, it's rewarding as well. And so a lot of people just see that part, not thinking about other areas in the health field. And so the Health Occupations Fundamental Certificate is really great because it does expose you to different areas in the healthcare field. Not just nursing, not just becoming a doctor, but what else is there that might be more suited towards what it is that you're interested in doing. So with that, we can help you prepare for staying at that level. Maybe it is nursing, maybe it's not. Maybe you want to consider healthcare administration, less patient contact. Maybe you want to do radiology or public health and advocate for the community, right? So there's lots of different areas. On the right-hand side, you'll see other majors that some of our students might pursue in the healthcare, including biology. We have other programs like pharmacy tech or biotech. And if you go to our other workshop for the application process, you'll see that there are some workshops there's some degrees that you might want now, because it gives you leverage when you apply to the programs. So for example, CNA, if you're working as an MA, if you're working as a pharmacy tech, you can get extra points because you're already within the field, and so you already have that leverage.
I'm sorry to interrupt. What about mental health field? How does that help, or does it even help when applying?
Usually it's certificated careers. Whereas and it depends, like in nursing, really it's EMT, MA, CNA, LVN. Those are the ones that they're really looking at because you have hands-on patient care. You know how to take vitals, you know how to do to read charts and all of that. So that's kind of what they're looking at. But different programs are different. That may count for something else too, for your work experience for sure. All right, so that's it for me. If you haven't made an appointment with me, we can definitely do that soon. I do have appointments for next week already. So if you want to do that, we are going to wait. Our speaker, she should be joining us. Any questions so far about nursing? Maybe on 2 minutes. So with the nursing programs, especially the ADM programs, that's usually what a lot of students, because if you look at the BSN programs, a lot of the closest ones to us is like Cal State LA, Mount St. Mary's, not that close, Bakersfield, Channel Islands, Long Beach, and San Bernardino. You're looking at private schools, you're looking at like Mount St. Mary's and Azusa Pacific, still not close, it's like Hawkville. But those are the ones within the area where you can directly go into a BSN program. If you're looking at an associate degree program, a lot of our students are more interested in those programs because it's much more local. So we have a lot of students with families, a lot of students who have a home out here, and they can't exactly just pick up and leave. And so, or maybe they're working in the area and they want to continue that too. So then the option for going for the ADM is not that bad because we have lots of schools to apply to, but I tell students to apply to both. And each program is different. So some of them are points-based and some of them are points-based, and then some of them are lottery. So if you're looking at programs that like Valley and Pierce, they're lottery. So a student with a 3.0 or 4.0 have the same chances of getting in. If you're points-based, you already have a bachelor's degree, you're already at the top of that list, right? Because that's extra points. If you have an associate degree, you already have extra points. If you have a license, you have extra points. So there's different strategies. Each student is very, very different. And so there's different strategies for you to get into it. I'd highly suggest making an appointment if you haven't already. But yeah, any questions so far? So we'll go ahead and wait for her. She should be on soon.
Are there any workshops that are offered here to help prepare for the TEAS test?
We don't. Maybe in the future, but it's a lot of information. There is on the ATI, it's atitesting.com. That's the website where you register for the test, and you can purchase your materials. Or maybe you make friends in your classes and they show you what their manual looks like. And then that will give you an idea of what to study. They have practice exams. They have different. So like, there's one of our previous students. She just said the the manual is okay. That's pretty much all you need. But then for students who need a little bit more engagement, there's like online tools too. So you can do a practice test online and see what that's like, if you're that type of student. Have you purchased it already?
No, but a friend of mine said she took a class, it was like a week class for TEAS test, and every day they go over one subject, like one day science, one day basically just like testing and all that stuff, and help a lot.
Yeah. So yeah, I think it's helpful for students who like really like the like face-to-face kind of. Was it, where was it?
It was local because she's in the Valley right now, and I could ask her, I mean, send an email to you, know what program it was, but she was like, it was so helpful because like for math, they would teach you how to do those tests because it's always like a trick to
It's
read
not
the
just the math,
English part and know how to answer it, and then how to answer the math part and all that stuff. And then, but it was like 3 or 4 days classes, long classes, like all day. But you could take it like right before the test, so it will prepare you because they go over all that. Not everything step by step, because obviously there's no time one day to go over all the sciences, but the way the tricks and all that stuff, it's all helpful for her.
It's only preparing for
Yeah.
like the GRE or this. All right, so now we have our nursing student. Hi, Judy. Hi, Judy. Can you hear us? Hi. Can you hear us?
Hey, hang on. Hello?
Hi. Can you hear us?
Sorry, I can. I was just inside, but it's a little weird for me to talk out loud. Sorry, this seems like an unprofessional setting.
No, it's fine. Don't worry. There's only a few of us, so it's fine. So we're gonna ask you questions about your experiences and everything like that, and then we're gonna mute ourselves. And if you're having a hard time, let us know. And then you can't see me because I'm behind the computer, but But yeah, we'll go ahead and start. How are you today?
What?
How are you?
Oh, I'm good. Definitely good. Sorry, a little tired recovering from clinicals, but I'm good.
Nice.
Can you guys hear me okay?
It's kind of cutting in and out a little bit. Can you hear us? Or me at least?
Yes, I'm wondering if I'm on my laptop. I'm wondering if I should just switch to my phone.
That might be better if you have better connection that way.
I'll be right back.
Okay. We've had issues before.
May I ask a question while we wait?
Yeah, sure.
So for me, that I don't have any hands-on experience aside from volunteering, what other things do you suggest I can do to get those points? Like,
If you have time to do any of the certificate programs, like health occupations, because then there's an externship that you can do.
okay,
CNA would be good. If you have a summer to spare, it might be worth it. But if you're going straight into the BSN programs, they're looking at like GPA. Overall GPA.
And the volunteer job, it's only not the regular volunteer that you can do in the hospital, right? Like only in the nursing part of volunteer job.
Yes, and again, it
just
depends on the school.
Because there was one school, they said that no, not the regular volunteers, because like anyone can go and do the volunteer job. Has to be like kind of a hands-on as a nursing like department volunteer job or something like that. They count that hours rather than just working in a hospital.
Yeah, because you can be the front desk of a hospital and that.
Yeah.
so then how do I acquire that experience,
you
given
can-
that I don't have any certificates?
You can request for, so like I said, if you have the health occupations, it teaches you like basic nursing skills, like how to take blood pressure, your life support, basic life support and all that. That would be a good one to have so that you can put that on your resume. They can take you into work.
Okay.
Hi, Jimmy.
Hi. Okay, I'm back. Sorry. Is this better?
Yes. Okay,
Okay,
so
great.
let's go ahead and get started. Tell us a bit of your educational background starting after high school and basically how you got into nursing.
Okay. Initially, I went to college at UC Santa Cruz, straight out of high school, I guess as a pre-med major. So I knew I wanted to be in the healthcare field. But then after a little bit, I didn't know if I wanted to be. So I went back to community college trying to figure out what I wanted to do. So it was a cheaper route. So for the next 2 years, I decided to pursue either computer science or business economics. Eventually, I chose business economics and went to UC Irvine, graduated with a degree of business economics and a minor in political science with the intention of going to law school. After that, I worked in the legal field for about 4 years. And during those 4 years, I actually questioned if I wanted to go back into medicine because I felt like that was my calling at that time. So after 4 years, quit my job and ended up going back to community college for 2 years. Started applying for nursing schools. Now here I am in San Francisco State's nursing program. Oh, and currently, right now I'm concentrating in adult critical care. Currently, I'm placed in the ICU for my capstone, which is like the senior project that you have to do. So it's intense, but it's really, really fun. I originally wanted to be a labor and delivery nurse, but I think being in nursing school, you start to figure out what specialty you want to be in. During the last 2 years, decided I wanted to be in critical care.
My next question, how did you prepare for nursing school in general? Like what courses, how did you research the schools,
Good question. Good question. Okay, it's actually I am kind of type A quite a bit. So what I did was I researched all the schools that I potentially wanted to go to. I applied to schools outside of the state and within California, but it's where you want to practice and where you want to be. So I kind of wanted to be in San Francisco, so I applied to school in San Francisco, research schools in San Francisco. But what you want to do is research what courses they require you to take. Now that's important because you want to create or organize something. I created a binder. So what you want to do is go to each school you potentially want to go to, and then look at what specialties they offer, where are they, the costs, write them all down. So for each school that you're applying to, write all the courses down and write all the deadlines for every term that they're accepting applications. I know it sounds tedious, but it'll save you time in the long run. I created an Excel sheet that had all the requirements for each schools, but then I also had to look. I don't know if you guys are familiar with assist.org, but look at assist.org and see if those courses line up with the ones that you're taking at your community college or in school, and see if they line up with the courses that they offer at the school. I had issues with that when I was applying to a school outside of California, so you just got to clear that up with them. In terms of preparing for applying for those schools, you also want to check out their workshops. Every time they offer like nursing workshops or admission workshops, go to them. Very helpful in telling you what courses you need, what GPA you need, if you're a competitive applicant, if you're, on track. And also sometimes they take note of that if you're applying their workshop. So it's a good upper to, and like stating your intention of wanting to go there. Also, what else did I do? Volunteering. So in preparation for nursing schools too, volunteering experience is very important. Some schools require, like San Francisco State, I think requires you to volunteer. I didn't know that when applying. I just volunteered regardless, just to see if I wanted to be in hospitals or nursing school. And yeah, I think most importantly, research each school and write down all the courses they require, what GPA, how many letters of recommendations you need, and have that all put together in each Excel sheet. So that way, you can stay organized on top of it and figure out if you want to apply to all these schools, like what's the fastest way for you to start applying and figuring out if you're on track into applying to the schools.
Cool. So we just learned about the different types of degrees in nursing, and our students here have, we have one student who has a bachelor's degree and we're taking their nursing applications or for nursing, and so they're kind of deciding what types of programs can they go into. How did you decide to go into an entry-level master's versus a second bachelor's degree? How did you decide which program?
Good question. Since I already have my degree, I decided to pursue a bachelor's degree. So this was going to be my second degree. I decided to pursue schools that had an ABSN. So Excel. This is for the one who has already a bachelor's degree. An ABSN, because it was faster, I can get out in about a year to 16 months. Each school is different, but most schools are 16 months. There's one school up here in Northern California that does 1 year, exactly 12 months. It's not cheap, just letting you know. It's going to be $90,000 and above. But they have loan programs that will cover that. As for the entry-level master's, my goal is to actually become a nurse practitioner. So I took the GREs, decided to apply for that program. Any master's program that actually was pretty short, so 2 years again. So that was my intention, looking for a program that was pretty quick. San Francisco State is 3 years, but it would allow me to get into the goal, to my goal faster. They have a bridge program where you can work for a year and then take a year, come back a year for 1 year nurse practitioning certificate. So that was something that I was interested in. Now for applying to BSN programs, you want to research the school. Always check the NCLEX pass rates on the BRN. So you might want to research that. Some schools, it just helps you get a level of like what how the school's doing, how their students are doing in terms of passing their NCLEX. That's very important. And cost also is very important. So that's something else that I factored into it. State schools are cheap. Community colleges are very cheap. So I'm not quite sure if you guys are into ADN programs or just strictly BSN programs, but I would say that BSN programs, state schools are a lot cheaper. I'm not advertising San Francisco State here, but they do have this bridge program, I think, with a community college as well. So they have more open spots for BSNs through our schools, through a community college as well. Um, yeah, I hope that answers your question. Is there something I'm missing in that?
No. You also mentioned your volunteer experience. Um, what kind of experience do you think for? Because you know that if you go to a hospital and you sign up to be a volunteer, it may not be hands-on or as clinical, but what do you think the nursing schools are looking for in terms of volunteer work or experience?
Oh, okay, for volunteer experience. My background also includes, let's see, I volunteered at a hospital, county hospital in their geriatrics department. So basically, I was shadowing a pharmacist, doing data entry for her. But sometimes these providers that you work for will pull you in into different scenarios. Like I got to sit with a doctor and see procedures happening in the geriatrics clinic, go to a dialysis. She would drag me to all these things, so I got to see that hands-on. But even though like my position only required data entry, that's still something in the health field, and you're giving your time up for free. I also volunteered in the emergency department just to see what it was like to be in a hospital, because I was, before nursing school, death scared of seeing people in the hospital. So it wasn't something I enjoyed, but it kind of helped give me an idea of what it'll be like in the future as to like my career. I would also suggest, I think anything works. If you have work experience actually, and if you're pursuing your, if this is your first degree, whether it's your first degree or your second degree, if you have some sort of work experience, they actually look for well-rounded people who can communicate with patients and aren't afraid to talk to patients. So you've got an upper there if you already, you're working, you're in a field. Like I was in the legal field, but totally different that when I applied to nursing school that, they knew that I had something to bring to the table. Also healthcare volunteering experience. Like you said, it doesn't have to be hands-on, but as long as, even if you're a greeter, I know most hospitals now, when they start accepting volunteers, they start you at the greeter position. Regardless, you're still helping the hospital community. So that still helps.
Cool, thanks. Our next question is, what was the application process like for you?
Not gonna lie, it's very tedious. There's a central application. What is it called? That one I didn't actually look up. I totally forgot. But there's a central application that, let me look that up right now, that all nursing schools, most nursing schools usually use. So you just input all your grades. Oh, nursing CAD. So nursingcas.org. Now, most schools will use this to just centralize all the applications, and you can just like fill in all your grades, fill in all your letter of recommendations, and then just submit them to each school. But maybe there's just one. Certain schools will ask you to write essays, so it'll be different for each school. But generally, they use that one application. Now, there are certain schools that you'll apply to that aren't on nursing CAS, and that's a whole nother ballpark. So if you're applying to CSUs and UCs, you got to use their system. But there's also a two-part system. So for CSUs, I'm not quite sure about UCs. I didn't apply to them, but you have to apply to the school through that general CSU UC application, and then you have to apply for the nursing program itself. So you have to get accepted by the school and the nursing program. Again, like I had said earlier, staying on top of it and being organized is very important. So when you write down the requirements for each school on, say, an Excel sheet or paper, it'll help you figure out where you can apply, when you can apply, and if you've completed all the prerequisites then. And I've had, like I said earlier, had difficult times with certain counselors in certain schools because they've messed up my GPA. So I had to clear that with them. So consistent communications with the school was also very important. That being said, it is a tedious process, but as long as you stay on top of it and organized, it'll be a breeze. And don't forget to collect your letters of recommendation. So the classes that you're in right now, if you're in, say, anatomy, physiology, or your chem teacher, stay on top of like being good with them, just because it'll kind of help you in getting that letter of recommendation from them, because it's important to have those letter of recommendations set for when you start applying. I think some schools ask for 3. So make sure you get on the good side of a lot of your professors.
Cool. So you mentioned you took the GRE. Did you have to take the TEAS
Yes.
test as well? How was that?
I did. Certain schools, I don't even know. I think there's the TEAS test. There's another test that they started to use. I'm not sure if you guys are familiar with it. I can't remember the name, but certain schools like Samuel Merritt up here in Northern California require a different test. It's not the TEAS test. It was, if you recall, general biology, and you've had your writing classes, it'll be very similar to in the basic GE level. But I recommend getting their book from ATI, ATI is the people who administer the TEAS test. So I recommend getting that book and studying from that book, or just taking practice quizzes online. It'll help a lot. As for GREs, I would also recommend getting a GREs book. I use Kaplan for that, and then just studied flashcards. But to get a general idea, you might want to just look at practice tests online as to what the TEAS are like, and then figure out what will help you. I was kind of weak in general biology, and that was some of the things that they had tested on the TEAS test.
Awesome. So moving on, what is nursing school like for you? What's the schedule like?
What is nursing school?
Classes are you taking? What are your responsibilities? A lot of us are, have their own families or taking care of other people. And so how would that look like as a nursing student also?
Not gonna lie, nursing school is not that easy. I thought after taking my prerequisites, I was done working really hard, but you do work really hard in nursing school too. It can be emotionally taxing. You got to be prepared for a lot of self-care on the side, because if you don't take care of yourself, it's not going to be an easy, it'll be a struggle going through nursing school. So right now, I think most nursing school programs actually lay it out for you. So I take 6 to 7 as an entry-level master's. I'm taking both bachelor's and master's classes right now. I'll be taking my NCLEX in June, July, but for my program, it's 6 to 7 classes per semester, and 2 of those classes being clinicals. Clinicals can take from 8 hours to 12 hours. I'm doing 12-hour shifts right now, night shift. So it's insane, but you have to fit everything in your schedule. And and my BSN counterparts are taking about 4 to 5 classes each semester. It's a lot of, you have to have reliable transportation because you need to get to your clinical sites. You got to do research, do work prior to your clinicals on top of all your other school workload. And, balancing life outside of nursing school, again, it's really hard. Like, you want to have a social life, but some things have to give on certain days. Like, friends, family, your significant others, work, school. I have classmates who have like 3, 4 kids, and balancing their kids with all the things that they have to do, like for their self.
Hello? Give her a second. Welcome back. Hello.
Hi. Okay,
We got you back.
great.
I think
Okay,
you got.
sorry about that. Okay.
So you're talking about how difficult nursing school was.
Yes. Sorry. It's a lot to balance, so I'm just gonna say this front. You gotta kind of match your time. Just trying, and also make sure that you have a lot of care. Like, it's very important. You take care of yourself, take care of your patients or your classes, and know your priorities. School is a priority. It will be. Your family is a priority, but I mean, everybody in your life is a priority, but know that, you went into this school for reasons. But it's a lot to balance, but you just got to make sure that you know how to balance everything.
I think that's really helpful. Start thinking about it. Next question is, how soon were you able to work with patients? Sounded like it was
Oh,
quick.
that's one part. So it depends on what program you're in, but during my first semester, I actually was able to work with patients. So, but not in like, not giving them shots or injections or anything like that. It was mostly like taking blood pressure in the community, talking to people in the community. Like, we had 2 rotations at income housings around San Francisco and Oakland. So checks, basic signs, and had a rotation at a started medications, worked nurse. If you don't know what a skilled nurse facility, but then as you get more into the program, the care gets progressed. So you get to, give shots, injections, talk to patients, start educating them on certain things, and you get more with patients. But it depends on the program. So sometimes you'll sit there 2 or even for that.
I think for you, you're breaking up a little bit.
Oh no.
So you were saying that you're working with them in the community as soon as your first semester?
I'm working with I'm sorry?
You said that in your first semester you started working within the community first?
Yes.
Okay.
But the one thing is that I want to say, when you start working with patients, be confident, but also know your limitations. You don't want to compromise the safety of your patients, yourself, or your RN's license. So it's always a balance of like, you're scared in the beginning of doing all these things to patients, but you also know that, you got to start somewhere, but you got to be confident.
So, I guess, are there any questions before we have our last question?
Just my.
Do you want to? Alright, so our question was about becoming a nurse practitioner. What is the most direct path in getting into that profession, that job title?
There are some schools that will grant you a nurse practitioning degree 2 years in. If you, I'm not quite sure if you've already had your bachelor's degree, or if you have a bachelor, if you're applying, bless you, if you're applying for an entry-level master's degree, or you're applying for a bachelor's degree. But if you're applying for entry-level master's, there's UCSF that grants you a nurse practitioning degree in 2 years. I think some schools are working on programs to give you a nurse practitioning degree in 3 years, like a public school. I'm not sure if mine's in the works of doing so, but it could be 3 years. There's Samuel Merritt that grants it in 3 years. It just depends on what school you want to go to, and it directly puts you into the nurse practitioner direction. If you're going for your BSN first, it'll have to be the BSN to, the RN to MSN programs. And that could take, so after you complete your BSN, it'll take like 2 years, and then 2 to 3 years, depending on where you go. And then it'll take another 2 years for you, 2 to 2.5 years to graduate from nurse practitioning school. Does that answer your question?
I think so. Yeah. suggestions or tips would you give a community college student who is interested in becoming an RN, especially since you're a community college student yourself, you take computer classes?
Oh,
What would you advise them
um, I would suggest, if you're doing your prerequisite classes right now, try to do your best in them. I know it's just that is the most important thing. You want to get good grades in them, but but not only like it's very competitive to get into nursing school. I'm pretty sure you're aware of that. I essentially gave up my life for about 2 years trying to to get good grades in my prerequisites. But I would also suggest is know your material well. First and foremost, like study that material, and then the grade will come. Um, Use Quizlet, flashcards, if that helps you. Any way that you could study. I used to draw pictures and consistently draw them, like diagrams, because I'm what is it? I learned by drawing and pictures rather than words. And it sounds, I'm not like it may sound discouraging, but like just to keep studying and like not knowing where you're going, but just keep pushing forward. Like always remember why you're going into this direction. It may be hard, but know why you're pursuing this direction and keep that as a reminder to help keep you going, because it will be hard. These are just, it's prerequisite classes. Sometimes you're like, why am I taking these? It'll be important when you get into nursing school. These things actually come back to bite your butt. So it'll be very important to remember what you're learning. I know sometimes I forget, but the things you're learning now is going to be fun, and it'll apply to what you're going to be learning in the future. And nursing school is way better. But again, everything is in preparation. So, it won't be easy after this point. Like after you do your prerequisites, it won't be easy, but know that the more you discipline yourself in the prerequisites you're taking right now, it'll help you in nursing school. Do your research, volunteer as much as you can. If you want to learn like what it's like to be in a hospital, shadow someone in the hospital. Ask if they have any opportunities to shadow, volunteer, and just check it out. And also, talk to friends or family who are RNs. They'll give you the best experience. The best advice is to see if this is something you want to do. I was actually afraid of blood, afraid of open chest cavities, afraid of wounds, just labor and delivery, seeing babies get born was just ugh. But but when I started, with nursing school and then all these volunteer things, it actually didn't phase me. And then you realize it's a process of life. So, know what you like, and know that if you're heading this direction, you don't have to be limited to just seeing those things. You could actually do clinic work and not have to see open wounds or any of that stuff. So nursing is diverse. Just know that even if you get into the nursing field, there's different things you can do. Also, importantly, research the schools. Cost is very important. My school actually costs $7,000 a year for tuition. Isn't that amazing? $7,000 a year. So if you apply for state schools, that's pretty good, because other programs that I actually applied to and got into, like in Chicago, $90,000 for a program, for 2 years. Mine is $7,000 a year. That is such a steal. So know your costs, knowing what your loan options are too, because some schools will offer loans. Like I actually get tuition assistance for some reason. Like my tuition's free at the school, so even though it's $7,000, it's free. Um, Also know what area you want to be in, because where you apply is where you're going to start doing your clinical rotations. So I go to San Francisco State. All my rotations are basically in San Francisco. So know where you want to be, because that's going to be your network when you start applying for work. Um, Reputations of school, the BRN pass rates, check that out, see how the school is doing, ask some people, alumni. Feel free to contact me if you have any more questions regarding that. I've applied to different schools. I have friends in different nursing schools. So if you want any more resources, just let me know. And, work in something healthcare related if you can. Find a job, part-time job. Having a part-time job again in nursing school is kind of difficult, even in prerequisite, doing your prerequisites right now, balancing that and school is kind of hard. I actually took a year off when I first started my prerequisites, because I knew I had to make sure I was disciplined in learning my subjects before I think I could tack on something else. So, if you can, work in something health related. I worked at a physical therapy office, and that was kind of hands on. It was pretty cool. So I worked as a physical therapy aide and got to help with, you know, delivering modulations and stuff to patients and interacting with them. So something like that, like, you know, interacting in patient care. But it doesn't have to be that hands on. You can still just do, you know, volunteer work at the front desk, knowing where everything is in a hospital. But like, I guess if you're interested in you know, like in nursing school, know that you just have to stay organized and stay on top of it. Everything, stay on top of it.
Thank you so much. Are there any last minute?
What is the experience of these two in terms of nursing school?
You want to share your experience?
Sure. I have two part-time jobs. One, I work in a pharmacy, which is kind of like a compounding pharmacy, like medication, not a retail pharmacy. And then the other one is kind of, I'm a health provider. I have two patients, which are basically are kind of like, they call it like a health provider. So I wasn't sure if that experience would count as a hands-on for my school when I'm applying for, because it's not a certificate, but actually I do work for, they call it home health services, that you go and take care of patients. So I'm hoping that would help for me to kind of like, well, I have that job for 5-6 years now. So,
wow.
So that's what I'm kind of like, I'm pretty much sure. And then on the other hand, I have a license, I'm a licensed esthetician. I worked in a skincare beauty part of it. So the reason that I want to be an RN is just like kind of be on the beauty side of this business. So, but I have to have my RN degree, so it's kind of everything.
You have a lot of experience. Definitely helps to be, you know, in contact with any, you know, patients, and being a home health care, that's actually very perfect, you know, like for 5 to 6 years. Um, it's not necessary to have some sort of healthcare experience. Some schools will require it, like I said, San Francisco State requires you volunteer or work in some sort of healthcare field. But that's, you know, like, that's excellent. You have all that experience, and that definitely will be, you know, like a plus on your application. But also, you said pharmacy, that stuff will stay with you. So a lot of nursing is a lot of medications. And so pharmacology, don't forget, that's important to remember, because a lot of what we do, especially if you're in critical care, is like balancing, you know, it's called hemodynamics. So what's going on in the blood. And so you got to know, you know, like your meds and what to administer. And nursing isn't as easy as I thought it would be when I first applied into nursing school, but it's a lot. You're almost like, I don't want to say you're a doctor, but sometimes you have to call out the doctor and tell them like, hey, you know, this medication's not working. Can you up it or change it to this medication, because I think that works better. And so you make the suggestions and you make the calls too sometimes. So that is very important. But not to say that, you know, like if you don't have healthcare experience, there's always experience that they're looking for. So I had a classmate who went to art school. So she was a graphic designer for 12 years. And I guess she was volunteering at Kaiser somewhere in Glendale, Pasadena. She was volunteering maybe for like a year, but that's all the experience she had in healthcare. And she still got into my program with, you know, her degree in fine arts or graphics design.
Right.
So just any healthcare experience works.
Yeah, I did apply for volunteer program. I just applied it, and then they were saying, I wasn't actually the first information, but then they were like, for nursing, most of the schools, they do require hands-on volunteer job. Like you can't just be in hospital and be a volunteer and do like a, you know, so. And then they said that some hospitals, you have to know a doctor or someone that can just refer you, and then you could just shadow them, and then that will count as your volunteer hours rather than just being in hospital and then do a volunteer job.
Okay. But what school was that?
The Los Angeles County, and then the Cal State.
Oh, okay. Definitely that actually sounds I guess, a better way in interacting with patients when you have hands-on. When I volunteered in the ED, I actually had to talk to patients to calm them down, give them things that they needed, like if they wanted water, whatever, like typically
Right.
it's kind of hands-on. But that's actually a good point to make, because then it allows the schools to see whether or not, like, can you interact with the patients, especially one-on-one, and that's very important. And
Thank
give them
you.
a positive experience. Mm-hmm.
Thank you.
And then do you want to share yours?
Oh yeah. I am an MA for 2 years already. I have experience in processing such as insurances, making patient appointments, but I also have experience in taking vitals, patients one-on-one, like phlebotomy, knowing my injections, knowing what medications I need, knowing how to,
Yeah.
if I need to mix them, knowing where to inject the person. I know phlebotomy,
Right.
how to find the veins, stuff like that.
Mm-hmm.
I know how to read charts and take taking history, working basically with a doctor. If I need to translate, I am bilingual, so
Okay.
I work as well with a doctor. If they need me to do an EKG, or they need me to
Mm-hmm.
do dilute a medication, then I could do that.
Right.
And I'm also certified as a medical assistant. I also
Definitely.
have some experience in chiropractic procedures.
Okay.
And
Wow. You're actually very experienced. You know phlebotomy more than I would. I'm still trying to work on my injection, my IVs, like starting IVs. So, you basically have an upper there. Even in hiring, I think when places are hiring nurses, phlebotomy is definitely an upper, because not a lot of nurses know how to do that, and we're still working on it. As a nursing student, I'm still practicing. Definitely, you actually, as an MA, have a lot of hands-on. I can't speak for all these, I can't speak for schools who, you know, and their admission committees, but you both have the hands-on. It sounds like you both have the hands-on experiences that'll, make you a competitive applicant for nursing school. It's just I would, like, on top of that, don't forget to your grades. Grades are very important, and your tests. So hopefully, you both are doing very well, and like, keep up with, again, make that Excel sheet. Keep up with, like, the classes that you're taking, and then if every semester, every quarter that you finish them, check them off your list of each schools that you want to apply to. So you can say, I finished it, and I have these to go left. And staying organized actually helps you if you want to get in faster. So if you're going to take summer school or online classes, organize in a way like, oh, actually took courses when I was doing my prerequisites. It took me 2 years, but what I did was I took online classes too. So Santa Barbara City College, West Valley College, like, some of them offered it in, like, during the winter time for 4 weeks. Other courses were offered, like, for 6 weeks in the summer. But if you want to get them out of the way, take them online too. Schools will, like, generally accept online classes for pharmacology, pathophysiology, and I think nutrition.
Where did
So
you
if you
take?
want to get that,
Where did you take the patho and yeah, patho and
pathophysiology and pharmacology, I took online at Santa Barbara City College.
oh yeah, I heard about that. So if you want to get an edge over it, you can take these classes.
Oh, Santa Barbara?
And it's online. So you don't have to.
Yeah, you definitely could take that online. Take advantage if you want to get that out faster.
Yeah, so if you want, yeah, and they count towards your BSN, right?
Oh, okay, good.
Yes, but make sure that it's cleared with all the schools that I applied to. So just make sure, like, ask the admissions counselor of each of the schools you're interested in. Like, can I take this class online? Um, with that being said, also when you talk to admissions counselors, like, you want to know, like, have a purpose, but also have the intent of wanting to go to their school. When you start writing your essays, cater them to the schools. Just gonna let you know, like, cater them to each of the schools, because some schools have different priorities. San Francisco State has a priority of catering to their community, and it's well said on their, the what is it called? They're not motto, but their intentions on the nursing school website. So each nursing school has different intentions. Make sure you make that point across in your admissions essays.
Awesome.
Thank you so much.
Thank you.
For
You're
joining us
welcome.
and spending.
Any other questions?
Good. Is it
All
okay
good
if
with questions?
you share your contact information so they can do follow-up?
Yeah. You can go ahead and email me. Angela has my email, so.
We'll email it up.
Okay.
All right.
Thank you so much.
Thank you.
You're very welcome. Good luck.
Thank you.
Thank you. Bye-bye.
Okay, you're welcome. Bye.